Welcome back. Well, 2018 saw an estimated 1.7 million new HIV infections globally and over 770,000 people dying of AIDS-related illnesses. Now, South Africa remains the country with the largest HIV epidemic in the world. And to discuss this further, we're joined, in fact, from our Durban studios by Health Minister Dr. Zweli Mkhize. And right here in Johannesburg, sitting next to me, in fact, AIDS activist Griselda Kananda has been living with the virus for over 2 decades. And Professor Jeffrey Setswe is from the research organization Aurum Institute. To all our guests, thanks very much for coming in. And I think, Griselda, let's start in studio here in Johannesburg with you. And, you know, we've been pegging this World AIDS Day as, you know, it's the day that we also roll out this new state-of-the-art antiretroviral drug set to be a game changer, not least because it's 1 pill instead of 3. What are your thoughts?
My thoughts are nothing has changed because ordinary people still have the same challenges that they've raised in 1983. And I'm glad that we have someone from a research institute so that we can begin to look at understanding what an immune system is and what the responsibility of the individual who's infected is supposed to be. Because we preach this pill as a one-size-fits-all, as if it takes away when people are stressed, it takes away when people are unemployed, and it's not a miraculous pill that takes away all those challenges. The reason we're seeing numbers increasing because we're selling these tablets as, you know, a miracle. And the unfortunate reality is we need to create an environment where people personalize the risk of being infected. And that's where we need to start. That infection is no child's play. It's not something pleasant. As Griselda, I can stand here and say 2 decades later, simply because I do have access, I'm able to treat the opportunistic infections. Any clinic and hospital currently, when you come presenting with, you know, a support Kaposi sarcoma, treatment options are not clearly understood by healthcare workers. If I come presenting with abnormal menstrual cycles, treatment options are not clearly understood by healthcare workers, especially when there's HIV involved. We have 30 different illnesses that are regarded as opportunistic infections. And to add side effects on top of that, we have not won the battle of teaching people how their immune system functions and what the responsibility is of the individual who's infected in the society around them that constitutes what we regard as care.
Yeah. Minister Dr. Zweli Mkhize, in our Durban studios, what's your take on what Griselda is saying? You know, as someone who is living with the virus, who is taking the antiretroviral drugs, is this pill really just is the only game-changing thing about it that it's 1 pill instead of 3, but all of the challenges still remain?
Well, I think that there are many challenges still that remain, but I think we mustn't take away from the fact that we come from an era where there was no treatment and there was no hope, and we didn't know what was there to use. And of course, with time, we've not only had treatment, but we've also had simplification of the dosaging and also an attempt to reduce the side effects, and also found drugs that have got a better potency to be able to reduce the viral load. And I think that those are indications of progress in the whole fight against HIV and AIDS. I've been to one hospital where we're talking about multiple drug-resistant tuberculosis and how many people have been treated and cured within a shorter space of time. I think that there are areas where we should be able to say we can see progress. And of course, the underlying issues excuse me, of poverty, of lack of adequate nutrition, of stress and discrimination and difficulties in social life, all of those issues are issues that we have to face up to. But the fact that there has been a huge reduction in the mortality over the years is something that's been significant, because it has actually improved our life expectancy and reduced the numbers of death, both at level of mothers as well as people who are living with HIV and AIDS. So I think that we need to keep a balanced view that basically says that there is a progress that we can note. Of course, we still note that there are a number of other outstanding issues that need to be faced as well.
Professor Setwe, as someone who does research in the field of HIV, as we sit here now on the 1st of December 2019, I mean, as the Minister says, we have made great strides. We know that mother-to-child transmission has been drastically reduced over the years, but are we at the point where you hoped we would be in 2019?
The HIV epidemic and the HIV virus is very difficult to get through to. We have made great progress. If you think of it, we first provided antiretrovirals in 2004. 2013 there was one pill, and 2019 we're introducing another one pill that we hope would help people to become virally suppressed a lot earlier. But all of us, our dream has been to find, number one, a cure or a miracle drug, you know, that does not come up with side effects, as Griselda indicated. But you know, it's not been easy, and I think we have progressed, you know, over the years. And I think if we continue to use now implementation research or operational research to test these medicines on people in the communities and get feedback from them so that before we roll them out, we're able to say, you know, we have addressed all the issues that are raised by all the people.
I mean, Griselda, you know, when we talk about the HIV story of our country, we talk about antiretroviral drugs, we're talking very broad terms, not as people who actually understand what it is to be taking antiretroviral drugs. Tell us about your story.
Just a point of correction, I'm not yet taking antiretrovirals, but I took nevirapine when I was first diagnosed, and I was pregnant, 7 months pregnant at the time, to prevent mother-to-child transmission. And, you know, the greatness within that is I was given a choice and an opportunity not to give birth to an HIV-positive child. And 22 years later, the stuff that I do on a daily basis, I wish someone could just package in research and help ordinary South Africans to implement in their own lives. I mean, I live in Africa. You go to China, there's Chinese medication. You go to Brazil, there's Brazil natural ways of managing an immune system. In South Africa, in Africa, why is there so much reluctance in investing in natural therapies? Why has it taken us so long that each time a person says, here's a concoction, I believe that it does XYZ, people are brought into my space in wheelbarrows, and we've seen progression, we've seen hope. Why does it take so long for us to begin to just, because when you talk about an immune system and how it functions, if indeed HIV is about the immune system, we need to then teach ways of strengthening immunity and helping people to manage their health on a daily basis, prevent opportunistic infections. And these things are doable. Why is it that it has taken us so long to invest in natural ways of managing an immune system? Because yes, we're celebrating that the mortality has improved significantly, and it is worth celebrating. But reality is, for people like me who have a weak liver function, antiretrovirals are not the answer.
Yeah.
And each time you raise this, it's like you are anti-antiretrovirals, and that's not the case. People have genuine concerns, and when are we going to incorporate this within our health systems and ensure that people live a quality of life and not see this pill as a way that's going to further silence those who are scared of talking about their HIV status. I was showing Professor earlier on a tweet when I mentioned that I will be on this show and this is what we're talking about. And I mentioned the basics of prevention and usage of condoms correctly as being one of them to prevent reinfection with different strains. And the person just says, but not using condoms is the nicest thing. So how do we even shift people from, seeing HIV as just one of those? As long as it hasn't happened to me, it's not a problem.
Yeah, I mean, Minister, what is your response to what Griselda is saying? I mean, we know the fact that we, as South Africa, still have 20% of the global burden of HIV, that education is still a very big problem.
Well, the issue of dealing with HIV it's unfortunately not just a government issue. It's got to be a multi-stakeholder program where everybody participates, and we have tried to pull together civil society, people living with HIV and AIDS, and traditional leaders, traditional healers, religious leaders, everyone to assist so that they can use their wisdom in helping us to, reach out to a number of people. Currently, we are working on the UNAIDS targets, which are about testing as many people as possible, such that 90% of those who are tested know their status. We're also encouraging early treatment, so as soon as you find that you are HIV positive, that you should receive treatment. And then we're targeting that there should be 90% of those who are on treatment who must be virally suppressed, which means, therefore, it helps us to reduce the chances of them transmitting the virus to the next person. So the approach is basically to try and deal with a huge problem, but trying to get everyone at the same time to take individual responsibility to protect themselves, to be able to protect those that they relate with, and also to try and look at how to deal with the issues of immunity and so on. Yeah. Coming to the issue of traditional remedies, there is no problem with anyone using it, except that to test it, the process is a very lengthy process because of the fact that to extract, out of herbs, substances that can show medicinal utilization is something that you have to go through particular processes, and that on its own is something that's taking long. Maybe in South Africa we took long because a lot of that is only starting recently. Over the years, the traditional remedies were condemned, but the new
Minister,
government is trying as well to
There's a
encourage.
question coming to you from the panel here. Why is it taking long?
Well, I think let's be fair on this question. There are a number of researches that have been done. The University of KwaZulu-Natal has had a unit that's been doing that, and there's quite a lot of work that's been done to try and record medicinal use of herbal remedies. But just to be able to have a scientifically sound process, it takes a while because of the processes and the cost that's associated, and also the fact that some of those remedies come up as are not generally as public knowledge, but also as individuals who are coming asking to be assisted. Now, I've been aware of a number of people who would come and say, well, I've got this herb, it can be used, but to move from an anecdote to a scientific proof is a process that tends to be rigorous. I don't think we must condemn, because there are herbs that people would have used and they believe that they can. They don't need to actually have gone through scientific analysis. But when you want to commercialize it and when you want to spread it in a wider setting, then I think you need to be very careful, because if there are any complications coming out of that, then the government will again accused of not having been scientific and rigorous enough on the matter. But I think over a period, this is an area that has really not been properly developed because of the history that we have come from, and it's something that's going to take us a while. I think being overwhelmed by HIV at the same time is forcing us now to say we should be looking at this and that and the other, and a lot of that requires quite a lot of resources.
Professor, what's your take on what the Minister is saying? Is that good enough?
We started very badly with research on HIV/AIDS. If you remember the Virodin issue in the late 1990s, when there was a drug called Virodin that was tested. But I think the HIV epidemic has started badly also, because we were divided. We were fighting one another instead of fighting the epidemic, and we wasted a lot of time when we were fighting one another. Over a period of time, civil society and government came together through SANAC and were able to do things together. Research was also recognized as an important component, but the HIV epidemic has not allowed us to be able to use our talents to the best of our abilities. While we were looking at treatment, we now started looking at prevention. We were very slow in prevention. We kept on harping on creating awareness and knowledge. And then we realized that the issues that Griselda was raising, that behaviors, attitudes, and practices are lagging behind. Now, if you look at numbers, and there's not competition here. Prevention and treatment are not supposed to be competing. We can do both, and we can do them well if we all spread our talents differently. But I think it's because we wasted a lot of time fighting one another, and now that we're working together, we need to start looking at how can we use the talents that are available in the country to concentrate on, if you have 7 million people, or let's say almost 8 million people with HIV and about 50 million people who are HIV negative, you can still have programs for prevention and still have programs for treatment that are working well, but also get other people who can look at things that are unique to South Africa, like if there are herbs that are specific to South Africa to treat certain aspects of the epidemic, we should be able to use the talents that are available in the country.
Unfortunately, to our guests, we have run out of time, but before we let you go, Griselda, just a parting shot from you.
I think for me what is a pity is those with money are able to advance their research methodologies. Those without money are dependent on the state, and it really requires boldness and wanting to eradicate HIV, because where we are now, it's so commercialized that the only response is more on how much it's going to give us. And right now the focus is looking at the 7 million people. If we can just put all those 7 million people on medication, this is how much it would make. It's taken us way too long. As Professor says that we can utilize all the talents, the time is now. We need to have an approach that is holistic, that allows people to utilize what they have where they at. We need to get to a place where we change these acronyms and remove even the intellectual arrogance. HIV, make it hope, is vital. HIV health is vital, and unpack what the meaning of health is and how many people understand what health stands for and how many have access to health care, proper health care, and AIDS into am I doing something.
To all our guests, thanks very much on this World AIDS Day. Griselda Kananda, Professor Jeffrey Setswe, and of course in our Durban studios, Health Minister Dr. Zweli Mkhize. And this is World AIDS Day 2019. The challenges still remain.